Good evening, everyone. Today we are going to start seventh unit in healthcare waste management system. So in unit 7, we are going to see about handling and disposal of radioactive and cytotoxic waste. So in detail, we are going to see about it. So first, we will see what is the definition of radioactive waste. So this radioactive waste is nothing but it is a type of hazardous waste or a dangerous waste that contains a radioactive material. And if you see in this healthcare, this nuclear medicine procedures, like you have certain nuclear medicine procedures which are used to detect and which are used to treat the diseases by using a certain small amount of radioactive material, and this is also called as radiopharmaceutical, okay, which are especially used in imaging equipment and which are helpful to detect the diseases. And mainly if you see this radioactive waste management, mainly this will include in a series like planning, preparation, treatment, packaging, storage, and disposal. And next, coming to the generation of radioactive waste. So what is this generation of radioactive waste? So this from where, what are the sources from where they are derived? Okay, they are derived from various sources. If you see, during again with the diagnosis, investigation, and treatment of the patient. So there are certain some sources where you can see here, that is through the X-ray machine, CT scan, PET scan, CM machine, LINAC, and radiopharmaceutical. So in detail, we will see what is this. For example, if you see X-ray. Here in the pictures, you can see a few images which are related. Like this is your X-ray machine where your patient is done to get certain investigation or diagnostic procedure through this uh, equipment. And here you have the report of the X-ray machine in various organs you can see here. So what is this X-ray machine? Now, for example, if you see this X-ray machine, this is completely belongs to a group of radiation that is called as electromagnetic radiation. And this machine, if you see, this sends the individual X-ray waves through the body. So what does this machine do is it will just send the X-ray rays waves into the or through the body of the patient, and the images are recorded in the computer. So whatever the images that you get through the equipment are, everything is detected in the computer or recorded in the computer. And this is a very special method for taking pictures and pictures of the areas inside the body, which you can see in a picture image here. And this machine will focus a very small, it focus on a small amount of radiation on the area wherever it have to be examined. And this X-ray will pass through the body, creating an image, like as I said you, and a film of a computer. It may be recorded in a film or a computer. And this photographic films or negatives, negative papers, or old X-ray films. Okay, all this contain silver at concentration, where these are very toxic. Okay, these all cause them to be toxic and a hazardous waste. So whatever I listed out, waste photographic film, negative papers, old X-ray films. Okay, because these all contain a silver concentration. So this have to be discarded properly because this contains a hazardous waste. So next, coming to your CT machine. What is the CT machine? The full form of CT is computer tomography. Okay, it is a computer tomography scan. This is also gives you a medical imaging techniques that is used to obtain internal images of the body in very detail. And this procedure, if you see, this uses a combination of X-ray and a CT, that is a computer technology. And this mainly, what does it show us? It will show you a detailed images of any part of the body. Okay, it may be bones, it may be muscles, fat, organs, blood vessels, etc. Okay, it just gives you a study, or it gives you a detailed study of any images of your body. And during CT scan, what happens is the person is exposed to a type of energy, okay, that is called as ionizing radiation. Okay, and this is a very like high extent of radiation. Okay, so the person here you have to remember is the person is exposed to a radiation that is called as ionizing radiation in the CT scan. CT is computer tomography. And next you have PET scan. So what is this PET scan about is like the full form of PET scan is positron emission tomography. What is it? Positron emission tomography. And this will completely reveal the metabolic and biochemical function of the tissues and the organs. And this is very advanced if you compare with your CT scan and or with your X-ray or an MRI scan. And this PET scan is used completely with a radioactive drugs called as it traces, because this will show you typical and atypical metabolic activity. Like it will show you a normal and abnormal metabolic activity of the organs that have been functioning. An example, if you see, like this is mainly used for detection of cancers and evaluation of the cancer treatment. Okay, mainly because here what happens is mainly we can detect the cancer. Okay, whether the patient has been suffering with like cancer, whether it is a malignant tumor. Mainly in the biopsy report, you will come to know whether it is a malignancy or whether it is a benign tumor. But here you can also evaluate the cancer treatment, because after you give radiation to the patient, after you give chemotherapy medications for your patient, after certain cycles, your doctor will ask you to go for a PET scan. So when you go for a PET scan, when a patient is going for a PET scan, they will just compare, okay, how is the progress of the patient after receiving the treatment. Okay, this PET scan helps in detecting and also in knowing how is the treatment working on for your patient. And whereas whatever the solid waste that has been generated in this nuclear medicine department, that is like paper or gloves or contaminated items, that is vials, etc., that have been used for the patient, the solid waste. Okay, and the liquid waste, like it may be certain pharmacological or pharmaceutical solutions or laboratory washing, etc. Okay, so this have to be discarded properly. And next you have is a C-arm machine. Okay, you have a C-arm machine. In the picture, you can see why this machine got the name that is C-arm, because this is in a shape of C. It is called C-arm machine because it is in a shape of C. You can see here, right? It is in a shape of C like this. And this C-arm machine, mainly this is a very advanced medical imaging device, same within your like X-ray technology. And for this machine, like you for one end, for one end, if you see, it is like connected with the X-ray source, and for the one end, if you see, it is connected with the dictator. Okay, it is connected like here for one end and the other end like this. Okay, this one and the other end is detected with the X-ray, and to the other end it is connected with a dictator. And this device is used to visualize mainly the patient's anatomy during the surgeries or during any operation. Especially this is used in an operating room like this. If here you can see, yes, how your like surgeons or healthcare workers are using it during the surgery or during any procedure. And this will produce the fluoroscopic images. Okay, because it is an X-ray source that is generated with the radiation and then passes through the patient's whole body, and then it will produce the image. And here you have to like because when it is used during the medical procedures, mainly to guide the placement of instruments. Okay, whether we are placing the instrument directly, whether we are placing the instruments properly in the uh, into the patient's body, or whether we are sending it correctly, and you can monitor and also progress the treatment, same like your PET scan. And next you have other investigation or a diagnostic procedure, that is LINAC. And this LINAC is also known as a linear accelerator. Okay, it is also called as a linear accelerator. So this device are usually used mainly for the treatment of the cancers. Okay, and because may and also for the external beam radiation treatment. Okay, this is also used for a external beam radiation treatment, and this also delivers high energy and high X-ray electrons to the region or for a particular wherever the patient is having the tumor. And next is the radiopharmaceuticals. So this radiopharmaceuticals, if you see, these are the agents that are used during the diagnosis of the patient, and also during to like for certain medical problems and also to treat certain diseases. Where here you can see the patient can be given in several different ways. Okay, treatment can be, or this radiopharmaceuticals can be given in a several different ways. For example, they may be given by mouth, they may be given through an injection, IV, IM, or whatever. And next, also through the eye also. Okay, through the eye also, you can give this radiopharmaceuticals in different ways. And these radiopharmaceuticals are nothing but these are the radioisotope molecules. Mainly, they will focus or they will target the specific organ, the tissue, or it may be a cell in the human body. Okay, this is about your radio pharmaceuticals. And next we have types of radioactive waste. So what we were talking about, different types of x-rays or investigation, right, sources. So here now we will see about types of radioactive waste. In this radioactive waste, you have so many types, okay, which are used in the hospital, like technetium 99, iodine 131, iodine 125, iodine 123, fluorine 18, and tritium and carbon 14. So just we will see what are these radioisotopes. So first one is technetium 99. So what is this technetium 99 is? Mainly this is used to image, or which is used to check the skeletal muscle and the heart muscle. Okay, not only this muscle but also the brain, the thyroid, the lungs, the liver, spleen, kidneys, bone marrow, etc. You have, okay, all this. Okay, whatever the organs, okay, it deals, you can just use to the image that is related with the skeleton, the heart muscle, your brain, thyroid, lungs, liver, spleen, kidney, the bone marrow, etc. And mainly this will localize and it will target it will just localize you, or it will just give you a target of a particular tissue on the or the organ where you have to focus and give the treatment. And this is estimated that about 25 million diagnostic investigations are performed through this technetium 99. How many? Estimated, like it is estimated about like 25 million diagnostic investigations are performed through this technetium 99. And coming to this iodine 131, if you see, this is a radioisotope of iodine, where your name is telling the same. And mainly this is manufactured and it is used in a medicine form, and this will play an important role like an radioisotope in the, especially in the nuclear medicine. And this is also used to diagnose the whole body imaging, iodine 131. And next, coming to your iodine 125, this is also a same radioisotope like iodine 131. So this is also used for your nuclear medicine and in the during the radiation therapy, because if you see, this radiation therapy is used to treat a number of conditions that are related to the cancer or the brain tumors, etc. And in this, contrast agent is used for the patient. Okay, you will just inject a contrast agent uh, before just before the investigation is done for your patient. And next one is iodine 123. So what is this iodine 123 is? This is also a radioisotope. If you see iodine 131, iodine 125, iodine 123, these are all the radio isotopes of iodine. And this is also same, like if you see 123 iodine is also used in the nuclear medicine, and mainly it is used to evaluate the thyroid function, how the thyroid is functioning for the patient. And it is also helpful to investigate or to come to know about more about the condition of thyroid, how it has been functioning, and whether any abnormalities are there related to the thyroid gland. And next, coming to the fluorine 18, and this fluorine 18 is a radioisotope as well. And these, like, easily it will trace mainly during the CT scans. Okay, during the CT scan, that is computed tomography, it will like easily trace out. And this, if you see, comparing to CT, this is mainly used in the PET scans, okay, mainly to to check the image of the brain and the heart, and also for the cancer patients to check the metastasis, like how is the spread of the cancer, whether the cancerous cells have been spread to the one part of the body to the another part of the body, or like that. You have to check the metastasis through this fluorine 18. And and this also used in treating certain internal tumors. And next, coming to this triton, this triton is also a medical and scientific setting for a radioactive tracer. It acts like a tracer, or it has been helpful and useful as a tracer. And coming to your carbon 14, this carbon 14, mainly this is used during the during any investigations and during certain surgeries of the patient. Okay, so these are about the types of radioactive waste. And next, coming to your like radioactive waste disposal. So what is this? Like we have seen so many radioactive waste, right? So how we have to dispose, that is very, very important, because radioactive waste are the hazardous and the dangerous materials, right? So it have to be disposed properly. So like you have certain concept here, like how you can dispose it, that is through delay and decay method, dilute and disperse, concentrate and contain, incineration, recycle and reuse or dispose. So what is this? We will see in detail. So here you have like a half life. Okay, what is this half life? This half life is nothing but the interval of time that has been required for one half of a nuclei of radioactive sample to decay. It is like half of the substance to leave the body and half to be decayed. Okay, so we will see in detail. So what is this delay and decay? That is the first step. And this delay and decay, the name itself is like uh, telling you, right? What is this delay and decay? So here in this delay and decay, like we will store short life material, and mainly this will allow the material that is there which we are storing, it will decay to the levels below the exceptional levels, that is half lines. So half lives are less than a month, maybe, if you are storing like this. In the picture you can see, right, in the containers you have been stored, what is being stored, the radioactive materials have been stored in it. So what you do is, when you just store it, the half life will be reduced. Okay, it will just less than a, you will keep it like less than a month. You will store like this, okay, for less than a month. And you have a storage room for this, okay, to delay. And in this delay and decay method, you have a storage room where it should be properly ventilated, and exhaust system also should be there in order for a proper ventilation or movement of air. And the storage space always should have a a lead shield. Okay, the storage space wherever you are like storing it, it should have a lead shielding, and it should also have a proper thickness, mainly to prevent the radiation leakage. Okay, the main concept why we are like delay, what we are doing this delay and decay method is, we are just storing the radioactive components or materials in a proper containers, where it should be with good lead shielding with appropriate thickness. Okay, because there should not be any leakage. And the radio, so by this method what happens is, the radioactive waste will like which have been stored for a minimum period of like 10 half life, it will just decrease the strength of the radioactive materials. And this waste also should be monitored for like for the residual activity, like if the dose limit is low, it have to be disposed as a liquid waste. So once you come to know that the uh, it is like disposed, okay, whatever the dose limit is being low, then immediately you will dispose it in the form of a liquid waste. So here in this what is that relay and decay mainly involves, okay, one thing I'll just tell you is, mainly it involves storing the low level liquid radioactive waste until until a required or a desired reduction in the activity had happened through the decay. So when you store like this, okay, and with proper facilities or proper principles, the composite will become decayed. And next, coming to your dilute and disperse. So what is this dilute and disperse means? Mainly discharging the low level liquid radioactive materials to the environment. Okay, so what you are doing is you are just uh discharging or you are discarding, okay, low levels, okay, which are low levels that are in a liquid radioactive materials or radioactive forms in the environment. And this can be like disposed in an or like an ordinary waste or a common hospital waste. Example, if you see like vials, the syringes you use in the hospital, cotton swabs, tissue papers, etc. So these all come under your dilute and disperse method. So this, and coming to the liquid radioactive waste, mainly with the activity, it have to be less than 1.35 microcuries. How many? 1.35 microcuries. If it is less than this, what I said you, that is, if it is less than 1.35 microcuries, then you can um, the waste that is being generated can be disposed of like into a sanitary sewage, like you have a sanitary sewages, right? So in the sanitary sewage system you can dispose it. When you will dispose, when the liquid radioactive uh, when the liquid radioactive waste is with the activity level of low level of 1.35 microcuries, then you will discard it in a sanitary sewages system. And after discarding it, you will just flush it out with plenty of water. And next, coming to the radioactive waste disposal methods, that is concentrate and contain. Okay, it is a simple example. You have so many movies based on this radioactive waste disposal. Okay, you can just blindly remember such type of, like, for certain examples. Like next, you have this concentrate and contain. So this concentrate and contain, if you see in this is a technique where you will be using certain materials which are very high active value. Okay, that means which is very highly active level, or the very high active materials of radioactives, that is containing radioactives, and which is having a long life. Okay, which is having a longer life than the month, where you cannot do this process in a decay and delay method. So you will go with such materials with this method, that is called as concentrate and contain. Okay, when the radioactive materials are very high activity, and which are more than, okay, longer than a month. And for such materials, what you do is, yeah, as we discussed, okay, when with the materials that are impossible or impractical with the delay and decay method. Here in this radioactive waste, uh, you collect, the waste should be collected in a suitable uh, it is collected properly in a suitable containers, and it should be designed, and it should be having a label containers. Okay, these all should be buried in a proper sites which are approved by the authority. Now here you can see what this people are doing over here. Now you see all this yellow color containers, okay, which are having radioactive particles or materials, okay, which are like high active, and which these radioactive materials are not suitable for, or which are not impractical or impossible with the method of decay and delay method. So like this, they just dump it or they just bury it. Okay, and next here you can see, after they bury, they just label it like this. Okay, caution, do not we cannot see clearly, but you can just see a caution here, right, where it is danger for the visitors, because this area is like a uh, is dealing with certain containers of radioactive materials, which is not good for the health. And next, coming to the incineration. Okay, the next method is incineration. So what is this incineration? Incineration is nothing but burning out. Okay, one word if you see in this, incineration is burning out. So mainly it is like destruction of something, that is especially the waste material, by burning to destroy the contaminants. Why we are burning, why we are choosing this burning method or this incineration method means mainly to destroy the contaminants. So here what happens is the insoluble liquid waste is destroyed by the system and ashes are being collected. If you see here, you can see, okay, you have a very big process where this dump machine have been come here dumping all the waste storage pit, okay, and through the crane it is being carried out here. And if you see with the other techniques like you see here, they are burning out, incinerating, okay. So when they are incinerating, the ash is being collected here. If you see, the ash is being collected here, and this should be disposed of properly as a solid method to a burial grounds. Now you see this ash method, now this is again collected. See here, this waste water and ash for treatment of disposal. So this ash, whatever that is being again generated through incineration, should be discarded properly, okay, in like form of like burials, etc. And next, coming to the responsibilities of waste. Hope you understood this methods like which we have seen here. You have like delay and decay, dilute and disperse, concentrate and contain, incineration, okay, recycle and reuse of dispose. Okay, these all like we have been discussed. And coming here, so what are the responsibilities of the waste generators? The who are generating the waste, what are the responsibilities of that persons? Okay, main first thing is segregation and storage of the waste that is being generated should be properly stored in appropriate time with appropriate scale, etc., until it is being disposed. Okay, until you dispose the waste that is being generated, what you do is you have to segregate it properly and you have to store it properly in proper place, in proper it also should be stored for a particular proper time with proper scale until the waste is being disposed or discarded. And next, they have to check properly the adequate radiation protection is there or not for the workers who are dealing or for the public who are dealing with this radiation. Okay, protection should be there. And next, we also have to check and see whether like suitable staff, uh, equipments, facilities, training, and operating procedures are available or not for the proper process. And next, proper documentation. Documentation is very, very important for each and every procedure. So, whereas here, when you are disposing the waste, okay, before the procedure and after the disposal, also you have to record it properly. So, how you have been processing, how you are like storing, how you are transferring, and how you are like disposing the radioactive waste, and this all should be done by the regulatory body. As you wish, you cannot do this process, but you have to follow each and every step like that is process, storage, transfer, disposal of radioactive waste with the regulations and instructions of the regulatory body. And next is your maintenance of records of waste management. So what is this maintenance of records of waste management? Here is mainly the thing here is records are important. Yes, records documentation is very, very important for each and every process or for each and every department. So here like we have certain list here. Mainly the description of the quantity is important. Okay, you have to describe the quantity, its physical state, okay, whether it is liquid, whether it is solid, okay, and what are the chemical characteristics of the radioactive waste and what is the date of disposal. Okay, everything should be recorded. And next, mode of disposal and the site of disposal also should be recorded, like how you are disposing it and where, at which site you have been disposing it. The information should be enclosed or it should be written in the records or registers. And also the name of the workers who are dealing with this radioactive waste disposal, and also especially the radiological safety officer who will be dealing with such radioactive waste, okay, disposal. Even the names of the workers and the officer name also should be recorded in the records or registers of the waste management. And next, a data of periodic radiation surveillance is also important that should be recorded it in, that is mainly in and around the site where you have been buried the ashes of water, or whatever the solid materials that we have seen, dumping all the high active radioactive waste, right? So all that should be like surveillance, and periodic radiation surveillance should be done in such areas where you have been like around the site wherever you have dumped it. Okay. And next one is emergency uh, preparedness plan. So what is this emergency preparedness plan is, like you have plan should be available, right? Okay, here mainly an approved emergency plan should be available in the facility to deal in emergency situation. Yes, you should have an emergency plan, and it should be available and enclosed to all the employees like who have been dealing with this. The facility should be there, like how we have to deal during the emergency situation. So mainly if you see, the plan should have site action levels, the remedial actions, yes, protection measures to control, minimize, mitigate the impact of emergency situations, and required improvements should be carried out. So if you see in this emergency preparedness plan, mainly the plan should be available to address whether any incidents have been occurred, incidents or accidents have been occurred, uh, just to help or to save the life. And also this is important for us to minimize the economic losses, and also to make less serious whatever the injury that is there or incidents that are there, we can mitigate it. Yes, we can mitigate it, the property damages, etc., in the emergency situation. So that is emergency preparedness plan. And nowadays if you see, like nowadays if you see in the modern age, modern days like this, hospitals have been increasingly using this radio isotopes. Okay, but we have seen now, if you see in the corporate hospitals, and nowadays people are like exposed to cancer a lot of, right, where they need a radiation therapy, a chemotherapy for their treatment. So where we deal with this radioisotopes, nuclear medicine, okay, for the diagnostic and for the treatment purpose. Whereas this will lead to the increased number of amount of radioactive waste that can be disposed in the that will be collected in the hospital. So whatever it is, once it is being collected, it should be proper disposed according to the guidelines that we have seen till now. And next you have a definition of cytotoxic waste. So what is this cytotoxic waste? Cytotoxic waste is just, it means the process or the substance, okay, that can damage the cell, or it can cause them to die. Yes, it is so toxic. That's why you have cytotoxic, the waste that has been associated with the psychotoxic drugs which contain certain chemicals, okay, and that are toxic to the cells, etc. And mainly like if you see, there are certain drugs, okay, there are certain drugs that is like here you call, what is it, anti-neoplastic, which can be administered to the patients like who have cancer diseases, okay, and multiple sclerosis, etc. Okay, because this anti-neoplastics can just prevent the growth of cells, and it will kill the cancerous cells. Okay, and this you have generations again for it. Okay, what are the generations of cytotoxic waste and its types, we will see. So any materials, okay, that come in contact with your cytotoxic drugs are considered as cytotoxic waste. So what are that waste and how it's generated is, if you see, syringes, vials, gloves, needles, yes, and respiratory masks, the personal clothing and equipment of the patient, air filters, and chemotherapy treatment drugs. These are all are deals with cytotoxic waste when these are all involved in psychotoxic uh, treatment for the patient. Okay, and rheumatic disease treatment, sharps used to administrate treatment, unused drugs and empty packaging, bed linen from a patient receiving treatment from cytotoxic drugs. Yes, a patient bed linen also is the cytotoxic, that have cytotoxic waste when if the patient have been received a cytotoxic drugs or a cytotoxic treatment. And hospital PPEs, that is personal protective equipment used during administrating drugs, because your healthcare workers, they wear PPE kits, right? For example, if you take gloves, okay, that is a common PPE kit, mask, etc. So this all should be like disposed properly, and these are the generations of cytotoxic waste and its types. And next you have this handling of cytotoxic waste, how you will handle the cytotoxic waste. First thing is, the preparation of the cytotoxic drugs must only be administered by a trained personnel, okay, who have to handle it. Only the trained personnel have to handle the cytotoxic drugs, okay, and during administration or during the preparation of the drug, okay, only the trained personnel can deal with this. And next, if you see the persons dealing with cytotoxic drugs and waste, always they have to wear the PPE kits. So this PPE kits includes the gown, the gloves, the mask, the cap, yes, and you have a shoe wear, okay, goggles, etc. So these are all included in your PPEs, that is personal protective equipment. So this PPE kit is appropriately used by the persons who are dealing with the cytotoxic drugs. And coming to the clothings that are contaminated immediately, okay, when you are preparing, or when you are like when you are preparing the medication that is related to the cytotoxic waste, this all should be uh, what you have to do is, yeah, when you are doing this, if it is being contaminated, yes, it is like it is contaminated with your PPE kit, or it is contaminated with your clothing when you're doing or preparing it, or when you're not when you are improperly handling it, so immediately it should be placed in a, it should be disposed, or it should be placed in the label bags, okay, that it is, so that label bags will indicate that it is a cytotoxic waste. This is the people who are collecting that waste will also follow proper techniques during collecting the waste. And the cytotoxic waste materials that are there, always it should be disposed in a double bag, okay, it should be disposed in a double bag, and immediately it should be sent for incineration, okay, it should be sent for the incineration. Okay, next, coming to your, hope you understood this handling the cytotoxic waste. And next is your preparation of chemotherapy. So what is this preparation of chemotherapy dosage for patients? So this mainly here, if you see, the chemotherapy patients should be kept in a separate ward, okay, especially only where the cancer patients are treated with chemotherapy drugs, and especially for treating patients with chemotherapy drugs, okay. And while preparing this chemotherapy drug, that is dosage for the patients, you should have a special hood, okay, you should have a special hood, like if you see in this, yeah, this is called as BSC. That is special wood is called as BSC, that is biosafety cabinet. Now you can see in this picture, okay, it is like a cabinet where trained personnel will be sitting through the cabinet, and they will prepare the drug, okay. So this, what happens is, this will help the people to deal with the drugs away from toxic effect of drug, and also it will help us to maintain the infection control, okay. Mainly it will help us to maintain the infection control when you just prepare the medicine for the chemotherapy or for the radiation, whatever it is, uh, by this biosafety cabinet, okay. And all the items that come in contact with the drug preparation should be disposed with the in a proper bins, okay. Wherever you are disposing it, it should be disposed in a proper bins, okay. And next, coming to the cytotoxic waste disposal method. So what is the cytotoxic waste disposal method here? Ideally, if you see the cytotoxic drugs that are expired, they should be returned back to the manufacturer, right? It should be returned back to the manufacturer. Otherwise, the hospital facility people can collect the psychotoxic drugs if you're not like returning back. Okay, this healthcare sectors can collect this drug, and it should be discarded properly. So like that, you have certain points where you have it in this proper cytotoxic disposal methods. So mainly, if any expired drugs are there, okay, it should be returned back to the manufacturers, and all the contaminated cytotoxic drugs that are there should be given a symbol. Okay, you should be given a symbol of cytotoxic waste. Okay, it should give you, because when you have a symbol for it, it is also easily for the people who are handling. Okay, for the other process also, it is very important. And also if you like yeah, once all these contaminated psychotoxic drugs are given to the authorized vendor, okay, it should always be covered with the yellow bag. In On that yellow bag, you should have a like a cytotoxic symbol on it, so that they will understand. Okay, it is in a yellow bag, and it is in a yellow bag, and it is covered with the yellow cover. Sorry, it is, I'm extremely sorry, it is covered with the yellow bag, and you have a symbol on it. Okay, it immediately indicates it is a cytotoxic waste. Okay, and once it is covered in this yellow bag, then it is taken for the common biomedical waste area for the treatment. And after that, you can just incineration. Okay, you can just have, you should also like, you should incinerate. Okay, you should incinerate. We have seen what is this incineration. Okay, so that is about your cytotoxic waste disposal method. Here mainly you have to uh, collect, or if any expired drugs are there, okay, it should be returned back to the manufacturers. All the contaminated psychotoxic drugs that are there, it should be returned back to the authorized vendors. Okay, when you are returning it back, it should be covered in a yellow bag with a proper symbol where it indicates that the bag is carrying cytotoxic waste, and it is taken to a common biomedical waste area. And after that, you can just have treatment for it, like you have a process for it, which you have seen in the earlier chapters. And then you can also just in the final time after the treatment, whatever is necessary, you will just incinerate that cytotoxic waste. Okay, so this is about your cytotoxic waste disposal. Here, if you see, you have a picture. Okay, this is a picture that is dealing with your biomedical waste management. Okay, you have a yellow color bin here, right? This yellow color bin with this mark. Okay, this is a has a biomedical or a cytotoxic symbol. Okay, this is a symbol. This is a biomedical waste symbol on the container. So immediately it will indicate that it is a hazardous substances that are there or present in this container. Okay. With this, we have finished this unit. Hope you understood. Thank you.